And routine checkups can play a key role in detecting illnesses before they become too serious. And Dr. Danielle Henderson, a clinical psychologist from IU Health, says that men all across the country are often skipping those checkups and instead of getting on a regular basis. And you know, it's interesting, Dr. Henderson, this is something I've heard all my life, that men just don't go to the doctor, even when it's obvious they need some medical attention.
Yes.
It's not getting any better?
No, unfortunately not. So we're still seeing that men are delaying their medical care, or like you were saying, sometimes not even going at all, even when it's really important that they do.
Why is that?
Well, sometimes there can be many reasons. Some might be it takes some time to figure out a plan to get into the doctor, to make that phone call or to send that message, to open up your schedule, see what works. Sometimes it can be frustrating because it does sometimes take a few offers of times of appointments that might actually work with yours. Then you might have to take time off from work. And then also there can be some nervousness or anxiety about going, especially if it's been a while since I've been there. What might they ask? Will I be able to answer those questions? And then I think for some people, what news might I learn? And maybe if it's bad news, what might that mean for me?
Would it be a good thing to offer to go with a loved one, a male loved one? Or does that make it even more difficult for that person because maybe he is so private he would rather not have anybody with him?
Yes, no, I think making an offer, because there's multiple stages to actually getting back and seeing the physician or medical provider. So would you mind if I drove you? Would you mind if maybe I walked in and sat in the lobby with you and we sat and talked, and then you go back to the room on your own after your name gets called? I'll be there waiting for you. And then I always think about, let's do something fun afterwards. Like we've taken some time off of work, or we've maybe delayed our entry into work, or maybe we got to leave work a little early. Let's go do something. Let's go out to eat, or just spend some time together to maybe talk about how the appointment went, and maybe try to have some fun with this.
I like that. Generational. Do you find that younger men are putting it off and older men might be taking it more seriously as they see their friends perhaps coming down with something serious?
You know, I'm not sure about that exactly, but I think that's a really valid point. I was thinking about that as I was prepping for this. Our peers, as we know, influence a lot. And so maybe at certain ages, if we have peers who are following the guidelines for different evaluations and testing, and they're coming back to the group and saying, hey, I did that examination, it wasn't that bad, or it wasn't the best, but here's how I made it through, then that might put it on the radar of some people. Whereas at younger ages, if you don't have those kind of national guidelines for screenings, you may think, well, I don't really need to go, and you don't hear anyone in your circle really talking about it.
I've just found that my dad, as he's gotten older, has been more willing to keep those regular appointments, those annuals or 6-month checkups or whatever, as he's, you know, unfortunately lost some friends and seen the severity if they had just gotten screened or something like that.
Yes.
So, well, we appreciate you coming in, Dr.
Yes,
Henderson.
always
Thank
good to be here.
Any last word for people to get moving and get to their doctor? And
yes, no, I think, you know, thinking about what are the personal barriers for me? Is it because I'm scared I'm going to hear some news? Is it because of some of the logistics? And who in my circle, who in my family can maybe help me with some of this and be support? Because as we talked about, there are people there who love you and want you around as long as you can be.
absolutely. All right, doctor. Thank you.
Thank
Enjoy
you.
your week.